I just want to discuss most important and basic things in heart's health, because it's the most vital organ that will get diseases at this age, especially. I think I see most of you are 50 plus. So I think this holds good where these are the most common doubts or questionnaires that everyone will get at this age. I think you can see my screen and everything.
Yes, we can. Yes,
You
we
can,
can.
yeah, perfect. See, these are the certain things that I want to tell you. I don't want to bore you, and I want to make these things as brief as possible. And we will give time predominantly for the questions that you want to ask me. The first thing is the heart attack, heart failure, sudden cardiac death. These are the words that you will hear, especially from the cardiac patients. Whether they're all same or they're different. That is one question that we should able to answer at the end of this talk. Second, whether the only people greater than 50 or 40 will get heart problem, or every age will get it. Third one, can I prevent heart attack and stroke? Is there any ways that we can prevent it from happening? Yes or no? The fourth one is whether every heart patients will have symptoms or only few, or if it is so, how what will be the other symptoms than which commonly known to us. Third one, heart problems runs in families. Is it genetic? Which are the issues that come in genes? These are the five questions that you should be able to answer at the end of this discussion. If any additional questions other than this, I think I will be happy to answer. Please post in the chat. So why it is important is this cardiovascular diseases is the leading cause of death and disability, especially, and it is progressively going, and it also adds a lot of cost and the burden on the health system, because especially in countries like India, especially it is much more important because people has to spend from out of pocket expenditure. So that's why we should able to know it and we should prevent it. Majority of times, once the country has progresses from the low income country to the high income country, or people once the country becomes more developed, these cardiovascular problems will increase. The reason being is we will live from a stage where dearth of resources to now the resources are more plenty. That means we have plenty of food, less activity, and less knowledge. All these things are most important factors that make society vulnerable for these cardiovascular diseases. So that's why we are in that phase where we are now treating heart attacks. Now the phase has came where we have to prevent them from happening, especially in the younger generation. So certain small lifestyle changes, some small practices which makes powerful differences in our heart health, like activity for 30 minutes or giving up smoking or having a basic healthy diet. These 3 4 small changes will make a lot of difference. So I want to discuss about these changes, not specifically about the what procedures, what the things and everything. So I want to discuss small things which we can change in our life. So one more thing, I think why these are increasing in younger generation, that also you will understand. So to understand all about heart, first of all you have to understand what are the parts of the heart. Heart is not one small chamber, it has so many parts in it. So if you see, heart will have 4 chambers. It has like 4 rooms in a house, and each for us to go from one room to another room, there is a structure called valves. That means they will separate the each rooms, and heart is continuously pumps with the help of a muscle which is called myocardium, and this muscle is supplied by so many blood vessels. It is called coronary arteries, and it also has some electrical wires in it, so which will produce electricity, and it will transmit and activate this heart muscle, and the blood will go to bigger arteries. This is called aorta and everything. These are the various parts of the heart. So heart will have diseases from all these parts. Like suppose if heart muscle is not working very well, it is called cardiomyopathy. That means this muscle either cannot work properly, or it becomes extremely thick and it won't fill it properly, or there will be some abnormalities in the electrical wiring, and it will lead to arrhythmia, that is irregular heartbeats, like short circuits that we get in a house. It is like a electrical problems of the heart. Sometimes the valves that will open from one chamber to another chamber will get disease, and they're called valvular heart disease. And sometimes the blood vessels that will supply the heart muscle, they will be filled with the cholesterol plaques, and it will lead to reduction of blood flow. That is called coronary artery disease. This is the most common disease that we see generally in the population. And sometimes the heart pumping function will become very weak. You can see here the heart muscle become very thin, and it is not pumping very well. It is called heart failure, where heart is unable to pump enough blood to the body, leading to various problems. So these are the various heart diseases. So there are varied symptoms for the various problems or various parts of the heart, and very rarely congenital. Like you might be knowing, some holes will be there between these 2 rooms, abnormal connections between various chambers of the heart, which generally seen in the younger population. But these problems can become symptomatic even after 50 years of age also. Don't think that this congenital problem is diseases of younger people. These get expressed at the age of 50 or 60. So this is important age where we have to screen for the congenital heart diseases also. So I think now you know answer for one of the question. It is not just the heart attack. There are so many diseases in the heart which we should be aware of it. Second, the most common disease, that is heart attack. What exactly happens in the heart attack and what exactly happens there? Just want to see this video. I'm going to explain during that process. You might have seen this in YouTube or TED
7 million people around cardiovascular disease, which causes heart attacks and other problems like stroke.
Can you hear the audio of this video?
Yes.
Yes, we can.
Is the world's leading killer. So what causes a heart
From
attack?
Sukoon Unlimited to everyone,
The heart
please feel free to share your questions here.
It can't get enough. Fatty deposits or plaques develop on the walls of our coronary arteries. Those are the
So here you can see these are the blood vessels that will supply the heart muscle. Slowly over the period of time,
Metro De Bruyne has joined the meeting.
these fatty plaques start depositing into these blood vessels and slowly will occlude the space for the blood flow to happen.
vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot.
Here you can see there is a underlying blockage which is there from quite long time. But one of the factor like stress or some uncontrolled diabetes, infection
Metro
or
De Bruyne
something,
has left the meeting.
it will suddenly will lead to damage of these connections that are there, and it will lead to so many abnormal chemicals will be released from this blockage into the blood, leading to a heart attack.
Will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction or heart attack. Things can rapidly
Krishnan has joined the
in
meeting.
the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients.
So most important symptom being chest pain, but this chest pain is seen hardly in 1/3 to 1/4 of the people. That means it is a common symptoms, but there are so many other symptoms other than chest pain. And it is not the left side. It can be anywhere from your jaw to the upper abdomen. Anywhere the pain or discomfort comes, then we have to suspect a heart attack until unless it is proved with the other diagnosis.
Describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen, but it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness.
So this is the most important thing, especially women and elderly people. Don't think that heart diseases comes with a typical chest pain and everything. They come predominantly in the form of exhaustion or the symptom like I'm able to do all these things a few months back. Now it becomes a little bit difficult for me to do all those things. That is how they will present it. So we should not ignore any symptoms and we should immediately come into attention to the doctor.
Tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical.
So the most important is, especially in diabetes,
Krishnan has left the meeting.
1/3 of the people doesn't have any symptoms. It is extremely silent. Until unless we do some investigations, we can never identify it. So it is very, very important to do the relevant test after a certain age. And
BK Bayana has left the meeting.
Call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite where tests are done to locate the blockages.
BK Bayana has joined the meeting.
Artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital.
so the most important is prevention, not the treatment. That's why after now we are understood what is heart attack and what
From
exactly
Smee to
happens
Pumpy to
there.
everyone.
So we
Should
should
aspirin be
understand
taken
what
open?
are the risk factors for the heart attack. Unlikely compared to the other infections like tuberculosis, COVID and everything, which is a single factor diseases. That means if you are exposed to the particular microbe, you will get a particular disease. Whereas this is kind of diabetes and also coronary artery disease or brain stroke, all these things, it won't have a single factor. These are all the multifactorial disease. Like you should have a hereditary background. You might be seeing so many people who are already having so many risk factors like smoking and everything, still they are not prone because they have a strong gene. They're blessed with the strong genes, and we can't identify by doing certain tests that whether some particular person is prone or doesn't prone. So everyone should think that I am prone for it and we should take all precautions. So hereditary is the most important factor, but only hereditary factors is not going to determine. There are so many other things like high cholesterol levels in the blood. That can be a genetic, or it can be we might have induced by having a sedentary lifestyle, smoking, diabetes, obesity, high blood pressure, emotional stress, lack of exercise, and certain dietary habits. So if you can see, the obesity and exercise both are different. Even though you are very thin, if you are not doing a proper exercise, it is one of the risk factors. So first of all, we have to understand these are the most common risk factors which we can change. Apart from that, age is the one factor, and men are more prone than women, and certain families are more prone. Those things we cannot change, but the one which are there here, majority of them we can address. Like we can control the cholesterol in the blood, we can stop smoking, diabetes we can control, we can reduce an obesity, we can be active and have a good diet, and blood pressure should be well under control, and we have to reduce our stress and emotional liabilities. So once we control all these risk factors, then we can prevent the either heart disease or the brain stroke. Like how we should do that.
So, Dr. Praneeth, we have a question in the chat box from Smita ji. She is writing, should aspirin be taken often?
No, absolutely not. I mean, it's not taken often. See, when this process happened, then you have to give the aspirin, but you should not be taking aspirin just because you suspect you may get heart attack in future. Only for certain people in certain groups, we will advise aspirin. There is I mean, that you have to take the help of a professional. I think.
Thank you, sir.
So I think this is the picture of Christian Bernard. I think majority of the people knowing it is he's the first person, a South African surgeon who did the cardiac transplant. He might have done roughly more than 100 cardiac transplant in his lifetime. But at the end of his life, what he thought was if he was focused on preventive medicine, he might have saved 150 million hearts rather than transplanting 150 after having significant damage with various diseases. So it is very, very important to prevent this pandemic of coronary artery disease. And this is a very slow pandemic.
From Star Metro, the broad to everyone. How often should we have a checkup for heart condition?
The question like how often? No, that I'm going to discuss at the end. Okay, first we'll understand how to prevent it. Then we will discuss about how we are going to identify early, even if it comes. So the smoking is the predominant risk factor which will lead to heart disease. So because it is the it is the important factor which will kill more than 6 lakh people every year, and the worst part is 28 of them are children and are estimated to cause nearly 10% of the cardiovascular death. That is the sorrowing part, because now people are getting exposed from their childhood, that comes from their parents, like as a second-hand smoke. It will lead to significant damage in their long term, even though they have not smoked in their lifetime. In the first 20 to 25 years of time, they are exposed to significant amount of smoking. So it is very, very important, and we have to be more responsible for our next generation also, not for just for ourselves. And if we stop smoking, then majority of them, I smoked till 50 already. So why should I stop smoking? Is it useful to stop smoking after smoking for 10-15 years? Absolutely, it is helpful, because if we stop smoking within 2 years, the risk will come down. That means 50% of the risk within 2 years of time, and it becomes equivalent to the non-smoker within 15 years of time. But substantial reduction happens in the first 2 years. So it is very, very important for any person to stop smoking at any age. So don't think that it is too late. It is better not to smoke rather than continuing. So people will ask me how to stop smoking. There is a 2 to 3 type of things where we can stop smoking. One is the cold turkey. This is the best method. Stop smoking or vaping at once. That means you decide now, and the next minute you will stop smoking.
Indra Beld has left the meeting.
This is the one which works
From
better in
Happiness
90%
Coast,
of the time.
to everyone. We don't have a choice.
And
Delhi air is full of smoke. How to prevent this smoking?
The second one is you have to cut down the number of cigarettes slowly until you stop completely. But this is so difficult to do it, but But it is the recent onset smoking, I think this works. But normally the people who have smoked for a quite longer period, the best one, the cold turkey method is the best one. Like stop smoking on particular day. And second thing, reducing only smoking only partial part of the cigarette and leaving it apart. And slowly this will also will. These are three different techniques where you can stop smoking, but the first one is the best one. Okay. And the last one, you have to take the help of the professional where you will advise it certain medications and such that you will be relieved of this addiction. So either of the technique that we can use and we should stop smoking. So what about the alcohol? I think every time I give a talk, this is the question people will ask me so many questions. So I just want to clarify this very clearly to you. So before talking about the alcohol, I want to discuss about two things. What is binge and what is moderate drinking? People will talk about I am a moderate drinker or social drinker and everything. So what exactly scientifically it means that the binge drinking means having a 5 or more drinks in 2 hours for men or 4 or more drinks in a woman. So these are the people where they are prone for extreme diseases, like not just heart, so many organs in the body will get affected because of the binge drinking. Whereas a moderate drinking means not more than 1 or 2 drinks per day for men and not more than 1 drink per day for women. This is the moderate drinking. So everyone has their own definition, but what exactly science says was moderate drinking is this. Okay. What exactly happens if you drink too much of alcohol? It increases the blood pressure. It increases the chance of stroke. It increases the breast cancer. I think everyone knows about liver disease. And it increases the chance of mental illness like depression, suicide, accidents, and alcohol abuse and alcoholism. These are the various mental disorders that will happen if you have that binge alcohol drinking. And it damages the heart muscle. This alcohol will increase the some kind of bad fats that is called triglycerides that will combine with another bad cholesterol leading to that fatty buildup that I have shown you in the last video, and it will lead to risk of heart attack or stroke. So people will think that moderate drinking will reduce the chance of heart disease and everything. But if you see, there is no research has proven a cause and effect link between drinking alcohol and better heart health. So if you are not an alcoholic, please don't start it, thinking that it is going to help your heart. And what is the scientific basis for the thought process being is in certain red wines, there are certain things like flavonoids and other antioxidants are there. And some people thought it will reduce the risk of heart risk. But the thing is, there is a very, very better alternatives like blueberries, grapes and everything easily available. If you want to have that flavonoids and other antioxidants, take the alternatives, not the alcohol. And what else it will cause? Because alcohol is very high in calories. So whatever you mix with the alcohol, like soda, juice or cream, whatever we mix, it has a lot of calories. And generally, if a small glass of wine and beer will have roughly 150 calories, it's like eating 1 or 2 sweets. And a cocktail is roughly goes up to 500 calories. So if someone wants to drink that minimal alcohol, you have to include into your meal planning.
Nilan Das has joined the meeting.
If you're planning a 2000 or 3000 calories, I think you are consuming 500 calories by just having one cocktail. So, and your tummy will be fully empty. So it is very, very important to understand that it is not just about damage, it's about high calories also, which will lead to various damage to the heart. So moderation is the one which, if you are already taking it, that will be better. But don't start drinking for unproven health benefits. That is the message that everyone should understand. Next one is caffeine. Caffeine is the one which stimulates the central nervous system. That means our brain will become a little bit active and it releases the free fatty acids from the adipose tissue and it will increase the urination from the kidney. So these are the three effects that caffeine will get. So caffeine is there in both coffee, tea and other soft drinks. That too in moderation, it is safe to the heart. That is not that it will help the heart, but it is safe to the heart. So that way, FDA approves up to 4 to 5 cups of coffee without a harm, but it varies from person to person. That means that it is not standardized. In a different cultures, in a different kind of food habits, these 4 to 5 cups is different. So whatever that is minimal that is possible, you have to minimize that. That is the most important thing about the caffeine. And exercise, this is the thing which everyone should understand. Before explaining about how to do an exercise and everything, I want to explain certain terminology. See, what is a sedentary behavior? what I'm talking about: sedentary behavior, light exercise, moderate intensity exercise, and vigorous exercise. What is the difference between all these things? Sedentary, I think everyone will know: sitting, reclining, lying, watching television. All this comes as a sedentary behavior. Whereas the light intensity activities means household work. This I want to emphasize, especially to the women. Cooking and the light household work, or walking slowly inside the house. This all comes under light intensity exercise.
Neelam Das has left the meeting.
Which is very, very important. People will think that by doing a household work, we are doing exercise. Absolutely not. This doesn't come under size exercise, which is going to help your heart. This you are doing it, but it doesn't make any difference to the heart health. What exactly it makes difference is this moderate intensity activities like brisk walking, biking, active yoga, swimming, any game or anything. All these things comes at a moderate intensity exercise. So by doing this moderate intensity exercise, we are going to get the heart health. Vigorous exercise, that is especially for younger people, like jogging, running, swimming, lap, playing tennis, badminton. All this comes as a vigorous exercise. But anything more than moderate exercise is good for the heart. And any high intensity exercise is not going to help the heart in any way more than moderate exercise.
From happiness coach DK Aurora to everyone.
And how much time and what way that we should do? See, at least 150 minutes per week of accumulated moderate intensity exercise or 75 minutes of vigorous intensity aerobic activity is the minimum that adults should do it. If they are unable to do because of any reasons, at least do something of it. But I think at least 150 of moderate intensity or 75 minutes of vigorous activity will be the preferable. So if you see this picture, I think it tells everything about the physical activity that we have to do. One, this 150 minutes or 75 minutes. Apart from that, you have to be active most of the time, and you have to sit the least possible. That means sitting is like new smoking. So that light intensity activity and the basic sedentary activities, we have to reduce it. We should be active always. That is the most important. And the next one is we have to add intensity. Slowly we have to increase our activity of this moderate to vigorous.
Anita Sharma has joined the meeting.
Such that our heart will be trained for, even though there is a significant event, that means significant disease comes, heart will be ready to handle it. And the most important in exercise is adding muscle. So it's not just the aerobic activity. We have to do strengthening exercises also. That too at least twice a week. That means almost alternate days. Apart from these aerobic activities like jogging, walking, swimming, we have to do strengthening exercise, especially after 40 years. That too for post-menopausal ladies. It is extremely important to do strengthening exercises, not just walking. And physical activity will make our mental health extremely good, and it gives the confidence, and it completely changes the mood. So when we are doing exercise, all these points we have to keep in mind, summarizing the time that we have to do, and we should not be sedentary at any point of time, and intensity should be more, and we have to do strengthening exercises for everyone at least twice a week, and this activity will give you a great mental health. So next, after quitting smoking and doing a lot of exercise, the most important is sleep. The sleep duration leads to hypertension and various heart diseases, and lack of sleep will increase the obesity. So what are how much time we should sleep and how we should sleep? So, and what are the risk diseases that will come when we are not sleeping well? So you can see a battery of diseases. It's not just the heart. You will get brain, Alzheimer's disease, cardiovascular diseases, cognitive decline, that means early dementia, and depression, diabetes, high blood pressure. Each and every disease that are there in every part we will get when we are not sleeping well. So how many hours should we sleep? That is roughly 7 to 9 hours of sleep is needed for each night. It varies from person to person, but it is roughly at least 7 to 9 hours, and kids and teens may need little bit more. And one more concept is, I won't sleep for entire week and I will sleep in the weekend. It is not going to help. We have to sleep regularly such that we should give enough time for the body to repair itself, tissues and blood vessels, and boost our immunity and increase the concentration and increase the reflexes. For all these things, we have to sleep regularly and daily, and in roughly in the same time. See, one day sleeping in the morning, one day sleeping in the night is not going to help. We have to streamline the sleep patterns with 7 to 9 hours a day. That is the most important part of the sleep health. Especially when we are snoring, we should not ignore it and immediately has to bring notice to a concerned professional. That means mostly a pulmonologist or a cardiologist. You should meet and get it evaluated for the snoring. And especially morning sleepiness is also a very important symptom of the heart, which we should not ignore. Next, weight. Obviously, every increase in 5-unit increase in the body mass index, it will lead to increase in cardiac mortality and also increase in the blood pressure. So we have to take care of the weight. So if you see, this picture tells everything about the weight. People will think that I want to reduce 20 kgs, 30 kgs, 40 kgs. It won't work like that. First of all, we have to understand and keep a realistic goal. It is roughly 5% of your body weight in short term. That should be your goal, and you should plan accordingly. And how to manage it? If you see this picture, the shoes means aerobic exercise. That means you should be active, such that our tolerance to exercise increases. Can you see the weights? So you have to do strengthening exercise to increase your muscle mass such that our body metabolic rate increases. And the dietary changes that we have to make. See, obviously we have to eat. Reducing your food intake is not going to make your weight less, because body has so much of compensatory mechanisms. So we have to make very smart choices. That means we have to replace your food with a better alternatives such that it will lead to weight reduction. And we have to manage the portion sizes, and which has to be done consistently and daily. So these are the 5 things that we have to keep in. We have to keep a realistic goals, and we should understand how much and why you should eat that particular food. And you have to be physically active, both in form of strengthening exercise and aerobic activity. And we have to make smart choices. That means proper food and also managing the portion. So all these 5 are equally important. Once we do this all 5 consistently for a longer period, then we are going to lose weight, 5% of the body weight regularly. It will lead to the significant weight reduction over the period of time. And coming to the nutrition. So the nutrition is a very complex topic, but I want to tell you most important things what was advised by all scientific communities, which are already
from
proven.
a Srivastava to everyone.
The most
how to make
thing,
the group aware of healthy options.
In every diet, there should be good intake of vegetables, fruits, legumes, nuts, and whole grains and fish. This is the most important component that should be there in everyone's meal. And replacement of the saturated fat with dietary monounsaturated and polyunsaturated fats are extremely important. So whenever we are buying especially packaged food, that we have to look into it such that predominantly it should be filled with a polyunsaturated fats. And the amount of cholesterol should be, and sodium should be, the salt and the cholesterol should be as minimum as possible. And we have to avoid the processed meat and refined carbohydrates and sweetened beverages as much as possible. So I think if you see this plate, this is how we should plan our dietary plan. See, everyone have their own food habits. You don't have to change your food habits, but you have to understand this plate. If you see this plate, 1/2 is filled with the fruits and vegetables. So any meal that we take, it should be half filled with the fruits and vegetables. And 1/4 will be filled with the protein. Protein comes from various resources. It can be from vegetarian, non-vegetarian sources. As it was seen here, I think we have to take care of that according to our food habits and the cultural practices that we do. And rest of the 1/4 will be the grains. But predominantly in Indian diet, we will fill this half plate with these grains, that too not with whole grains. We will fill with the refined grains in the one half of the plate, and rest of the 1/4 will give protein and other fatty things. So this is how we have to change. We have to change the portions, not the specific particular foods. By eating one particular food, we are not going to become healthier or unhealthier. It is the portions that makes a lot of difference that we have to understand.
From Sivakuma PR to everyone. Can seniors do HIIT workout?
And after doing all these things, do you think the heart diseases will never happen till end of our life? Absolutely not. It can happen. By doing all these things, we are preventing heart attacks, but the blockages and heart diseases can happen. But how to identify it? So we have to risk stratify, because each and every person is not vulnerable for every disease. Some people are vulnerable for heart problems, some people are vulnerable for kidney problems, some people are vulnerable for joint problems. So we have to understand who are prone for which kind of diseases, and we have to concentrate our evaluation towards them. So if you see, these are the basic things where everyone can check it, frankly saying, without much of professional help. That means we should meet a professional. After that, we can check our pulse rate, BP, saturation, which can be done at home by everyone, and do some basic blood tests like blood sugar, cholesterol level, hemoglobin. Get one ECG and echocardiography and treadmill test, and all these things can be kept in a calculator which is easily available in any Google. This is a risk estimator. That means by adding these basic values, it will tell us what is the chance of having a heart disease. It doesn't mean that it will come, but it will tell that these are the risks that is there. So based on that, we can thoroughly evaluate for the further diseases. So what are the different ways? Treadmill and stress echo, especially majority of the times ECG and echo. This is the investigation that majority of us know. ECG is like detecting the electrical activity that is coming from the heart. Echo is sending ultrasound waves towards the heart and checking how heart is working, like whether heart is of proper size, whether it is beating well or not, how the walls, how the structure is there. All these things will be known by echo. But ECG and echo both are a resting investigation. That means when we are resting, how the heart is functioning, that much we know. But when heart was given an additional stress like walking or jogging, like in treadmill, where we will do one ECG when you are walking, that is called treadmill test, that will detect whether how heart is functioning in a phase of stress. That will tell us, that will predict us about the long term diseases that we have. So we have to do TMT or stress echo depending upon the situation. And for older people who cannot walk, this is an alternative of doing a stress echocardiography with the help of certain medication. So if both are normal, like treadmill and stress echo is normal, do you think it is 100% no disease is there? Absolutely not. Still, there is a 5 to 10% possibility that we can have heart disease. That's why we have to do first risk calculator. People who are prone for heart issues, like people who are diabetics, who smokes, who has a strong family history, like one of their siblings or parents are exposed to heart disease at much earlier age, they should be thoroughly evaluated. So that should be done with the help of either CT angiogram or conventional angiogram. That will be decided based on all the investigation that are available to the professional. Then we have to decide whether it is needed for a particular person. But these are the various modalities that we should use to identify the heart problems. So summarizing the things, first of all, we have to eat a healthy diet, be physically active, and reduce the cholesterol and sodium in the diet. No alcohol, no smoking. It's not moderate alcohol, it is no alcohol and no smoking. And we have to reduce our weight and have a good sleep. And if you are having a diabetes or hypertension or thyroid, you should have an adherence to the medications. And most important is take the help of a professionals when it is needed. And even though there are no symptoms, please meet a professional to get it evaluated. First, at least meet a family physician to understand what sort of investigations or what kind of specialists that each person should meet based on their risk profile. Some people will are prone for kidney problems. They should meet a nephrologist specifically and get it evaluated thoroughly. Some people are prone for heart issues. So then they should meet a cardiologist and get it evaluated whether they are prone for these diseases in future. So all these things should be very, very important in our lifestyle. Okay, this is what I want to conclude. I'm happy to answer your questions. I try to conclude as fast as possible such that I can answer your more questions. I think there are some questions in the chat box. First, I will answer them. How often should have you check the upper heart? See, it's no specific frequency per se, but it depends upon the thing. Especially when we are between 20 to 30 years of age, that frequency will be for every 5 years. But once we crosses the 30 or 40 years, it should be annually that we should get it checked. But people who are highly prone, like diabetics and everything, that frequency should become much more than that. Maybe 6 months will be better. We don't have a choice. Delhi air is full of smoke. Absolutely. See, it is a collective thing. Certain things we can do it at individual levels, and for certain things we have to do as a collectively, and we have to change the policies. What is MET? MET is a metabolic equivalent. Like, I mean, if I want to simplify it, when we are sitting, the amount of energy that we will consume is called 1 met. So when you are doing activity, the met will increase. If you are doing double, if you are spending double the energy than you are sitting, it is 2 mets. If you are spending 3 times the you are sitting, then it is 3 mets. So we have to roughly do 4 to 6 mets for moderate intensity activity. More than 7-8 mets, 7 to 8 times our sitting energy consumption. That will be vigorous activity. Can seniors do high? No one should do high intensity exercise. See, high intensity exercises are not going to give any heart health. That everyone should understand it. High intensity exercises are predominantly for the sake of muscle building. I don't think senior citizens are after certain age they are preferable. Do vigorous activity that is sufficient enough to maintain muscular health and also heart health. How many eggs to eat if I'm diabetic, and how many eggs for those undergone bypass surgery? There is nothing like number of eggs per se. Uh, uh, it depends on the body weight and everything, but until unless anything less than 5, it is acceptable. Any more questions?
So if there is any more question, you can unmute yourselves and ask also now.
Anyone who undergone any cardiac procedure here?
Hello?
Yeah, I can hear you, please.
No, you said it is not advisable for seniors to do HIIT workout. That I agree. Hello?
Yes, I'm hearing you, please.
Instead, can seniors do light push-ups and squats?
No, squats and push-ups are not high intensity exercises.
Okay.
If you do 100 push-ups continuously, then it becomes high intensity. You should know the limitation.
All right. Just I do for just 20 or this thing, 20 or 30 push-ups. Is it okay?
These push-ups and squats and everything, that depends upon your musculoskeletal health. That means if your bones and muscles are intact and well, because it depends upon the age group and a particular person. If you are fit enough to do those things, you can absolutely do. But you should not push your limits. That you have to understand it. Don't start new push-ups at the age of 60 or 70 and start doing 20 and 30. If you are habituated to do it from longer period, please continue that.
Okay, right.
No need to stop it just
The
because your age
squats,
is started to move. Absolutely, that also I'm telling you. If you are intact hip joint and the back, there is no disc prolapse and all those things. If it is not there, absolutely you can do that.
Okay. No, the Torpikarnam they are telling that squats before the Ganesha idol they will do it, holding both the legs in the cross leg instead of that is earlier. Shall we do that 10 or this thing instead of squats?
The thing that's what I'm telling you. It depends upon your bony health. See, try to understand that you have to assess your bones and joints. They are not going to be the same when we are at 20 years of age. So that we have to understand it. If someone has trained himself or herself from a quite younger age, like 30s or 20s or whatever younger age, where if you have trained yourself for those movements, yes, you can do. Otherwise, it will lead to spasms, injuries, and everything. Do much more softer and easier exercises than doing some complex squats and push-ups.
Then what are some light resistance and strength exercise you are suggesting?
See, most important places where the fractures will happen is one is in the back, the spine, another one is in the hip joint, another one is in the wrist joint. So these are the groups of muscles that we should work on those things, like pushing the leg and lifting some weights of. Even your lifting your hands itself will give a lot of strength to your back muscles. I think initially you should take help of a physiotherapist or a trainer to get it trained little bit, and get your strength. Then you do it. It should continuous process. It should be done for years. Then only it will give a benefit. If someone exercises for 3 months or 6 months, it's not going to make a lot of difference. If they do consistently minimal exercise also for a year, for a decade, it makes a lot of difference to their health. It's like investment. Even if you do minimal investment for a longer period, you are going to get more returns than investing a lot of amount in a shorter period.
Sir, I had asked a question about the checkups.
Yeah.
So Samitra sir's question was, how often should we have a checkup for heart condition?
It depends upon the particular person risk profile. That means if someone is diabetic, suppose for example, I will tell you two case scenarios, two different scenarios for your understanding. Suppose if someone of 60 years of age who is diabetic and whose father had a cardiac illness in the past, one of the sibling underwent some cardiac procedure a year back, this person needs more regular follow-up, like every 6 monthly should get it checked to find anything is there. Suppose if a 40-year person whose CT angio is normal, ECG, echo, treadmill, everything is normal this year, I think I will ask them to come after 5 years. I don't ask them to come every yearly, annually. Based on that, you should, first you have to meet once, and based on your first evaluation, then we will decide on the frequency.
Sir, I was asking a question. I asked that question that I'm a diabetic for about 35 years now. So I'm been given ecospirin, baby ecospirin to prevent strokes. Is that okay to take regularly?
Yes. See, I think there is a lot of scientific discussion that happened on ecospirin from past, I think 2 to 3 decades. There is a lot of new research came over the period of time. See, one thing that we have to understand is there is no exact answer for it, but I want to tell you certain things that are already proved. Initially, when we thought diabetics are more prone for heart issues, then we start giving aspirin for majority of the people. That means that happened in 90s predominantly. So once we followed these people for a decade or so, certainly the chance of heart strokes and brain strokes are significantly came down. There is no doubt about it. Substantial number has came down. But the problem is it is associated with bleeding because it is a blood thinner. If people who are having some ulcers in their abdomen, in their intestines and everything, they started bleeding, some of them. So some people who never had any heart attack in their lifetime, but because they're taking aspirin, they start bleeding. So then we stopped giving aspirin to each and every. Suddenly the thought process was to stop aspirin for everyone. Don't give just like that until unless we find some disease or so. Then suddenly these people start getting more heart attacks and more strokes over the period of time. So then what we understood was, in these people that we are treating with an aspirin, we have to segregate people who are prone for these heart attacks and we should give only to them. So it is worth taking risk of bleeding if your risk of heart attack is more. If your risk of heart attack is lesser, then there is no point of taking risk and taking risk of bleeding. So that's why now we have better investigations like CT, treadmill, and everything. If something it shows, then you can take an aspirin. Otherwise, you don't have to take it.
Yes, doctor. Yes. Yeah, because my family, one doctor has recommended ecospirin.
I know.
The other doctor is telling, no, you will have brain bleed if you
Both,
take this like this,
both
So I'm
are
a little confused. Both are my doctors.
both are true. Both are true. No one is wrong. They told you for you only. I think, but the best interest of you, both of them told. But the thing is that you have to understand is there are better investigations to risk profile you. That means whether you are prone for more bleeding or more strokes. If you're prone for more strokes, obviously you should continue aspirin.
Yes, yes. No, my dad died of an ischemic heart attack. So, and I have a family history and the cholesterol and all that. That's why maybe I was given that ecospirin.
Exactly. So you can do some CT or something and
Yes.
understand what is happening. If nothing is there, you don't have to continue. If something is there, then you should continue.
Yes, doctor. Yes. Thank you so much, doctor.
In case there is any more question or any unanswered queries from anyone, else we can wrap up this session. Okay, okay. So Dr. Praneeth, I don't see anyone else
I
asking
have
any-
a
Just
question.
1 minute. How long you can go on taking EcoSprint?
How long? No, if you take for longer period, for a decade, it will help. But taking for few weeks or few months is not going to make any difference.
I'm taking it for last 20 years.
That's what I'm doing. Then it will benefit you for this one.
Uh,
By taking for few months or years, I don't think it makes a lot of taking alternate days, taking weekly ones. This is not the way that we should take it.
Okay, thank you.
Uh,
How
in-
much? Just wanted to know how much probiotic capsules helps.
Sir, that is what probiotic and what condition. That is, I mean, I think you should ask a gastroenterologist per se. But yeah, probiotics is going to help. Certainly, there is no doubt about it. How much means you can't quantify it by some particular number. Certainly, it will help. No doubt about it.
Okay, thank you. Thank you.
I have a question. In one of the slides, you mentioned that 150 minutes of exercise is required every day, correct?
No, week. It is for a week.
Weekly. Oh, okay.
Weekly, 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise weekly. That is the at least that much you should do. If you do more than that, it is well and
So if I do half an hour of yoga every day, that is fine.
Yes.
yes.
Okay.
That comes as more of I mean, yoga has both aerobic and strength exercises. Both are there with flexibility. Yes.
Okay, perfect. Thank you.
Okay, so I see that there are no more questions anymore. Okay. Thank you so much, Dr. Praneeth, for making some time here. His schedule has been extremely packed, but somehow he did make up the time this week to go through the process with us even before coming today for the session as well. Thank you so much, sir. And I'm sure that all the community members and all the participants have found this session extremely insightful. Spita ma'am has written in the chat box that this was a very informative session. Thanks a lot. And Dr. Praneeth, many thanks on behalf of Team Sukoon and Sukoon community.
Thank you so much. I think I met wonderful people today. Too many young people. Young in their hearts, at least. That I can see that.
Heart is all that matters.
Yes. Wonderful.
One last thing, sir. Can we eat for our heart light butter every day? Little light butter. That light, it comes LIT. Amul light.
That's
These
what I'm
kind of
telling you.
butters.
If you see
Butter.
that plate, you can eat everything. The plate that I have shown you, there is nothing like you should eat something or you should not eat something. Don't think that just by eating a spoon of ghee will make heart unhealthy. So in that portions, if it fits into it, you can absolutely take it.
Okay, sir. Thank you. Thank you very much. Very informative. Thank you very much.
Thank you very much, sir. Thank you so much for clarifying all the doubts.
Thank
Look
you.
forward to having more sessions with you.
Absolutely. I'll be delighted.
Thank you. Thank you very much.